Your chest feels heavy. Every breath burns. The cough won't stop, day or night. Many people think it's just a simple cough, but sometimes it's something much deeper and more dangerous. Bronchitis affects millions of people every year, and if you ignore the warning signs, it can turn a small irritation in your chest into a serious breathing problem. Today, Dr. Rice is going to explain everything you need to know about bronchitis, what causes it, how to recognize the symptoms, and what you can do to protect your lungs and breathe freely again. Bronchitis happens when the bronchial tubes inside your lungs become inflamed. These tubes are responsible for carrying air in and out of your lungs. When they become irritated and swollen, the airways narrow and fill with mucus. This makes it harder to breathe and triggers that persistent cough many people experience. There are two main types of bronchitis. The first is acute bronchitis, which is the most common form. It usually develops after a cold or viral infection and may last for a few days to a few weeks. The second type is chronic bronchitis, which is a long-term condition and a form of chronic obstructive pulmonary disease. Chronic bronchitis causes ongoing inflammation and mucus production in the airways and can last for months or even years. One of the biggest problems with bronchitis is that many people ignore the early warning signs. At first, it may feel like a regular cold. You might notice a mild cough, fatigue, or a sore throat. But as the inflammation grows, the cough becomes deeper and more persistent. Thick mucus may start to appear, sometimes clear, yellow, or even green. Dr. Rice explains that a cough lasting longer than 3 weeks should never be ignored. This could be a sign that the bronchial tubes are inflamed and struggling to clear mucus from the lungs. When mucus builds up, it blocks airflow and becomes a perfect environment for infections. Other symptoms of bronchitis can include chest tightness, wheezing, shortness of breath, low-grade fever, chills, and constant fatigue. Some people also feel a burning sensation in the chest when they breathe deeply or cough. The body is working hard to fight inflammation and clear the airways. One of the most common causes of acute bronchitis is viral infections. The same viruses that cause the common cold or flu can also infect the bronchial tubes. This is why bronchitis often appears after a respiratory illness. Bacteria can sometimes cause bronchitis as well, but viral infections are responsible for most cases. Environmental factors also play a major role. Breathing polluted air, cigarette smoke, chemical fumes, or dust can irritate the airways and trigger inflammation. People who smoke are at the highest risk because cigarette smoke constantly damages the lining of the bronchial tubes. Dr. Rice warns that smoking is the leading cause of chronic bronchitis. When smoke repeatedly irritates the lungs, the airways become permanently inflamed. Over time, the body produces excessive mucus to try to protect itself, but this mucus ends up blocking airflow and making breathing more difficult. Another risk factor is a weakened immune system. Children, older adults, and people with chronic illnesses are more vulnerable to bronchitis because their bodies have a harder time fighting infections. When bronchitis develops, the body immediately begins its defense process. The immune system sends cells to the inflamed area to fight infection and repair tissue. However, this process also produces mucus and swelling, which leads to coughing and breathing discomfort. The cough associated with bronchitis is actually the body's attempt to clear mucus from the lungs. While it may feel uncomfortable, coughing plays an important role in keeping the airways open. Suppressing a productive cough too early can sometimes slow down the healing process. Dr. Rice explains that most cases of acute bronchitis improve with time, rest, and supportive care. Drinking plenty of fluids helps thin mucus, making it easier for the body to clear it from the lungs. Warm liquids like herbal tea or broth can also soothe the throat and help reduce irritation. Humid air can also make breathing easier. A humidifier or steam from a warm shower helps loosen mucus and calm inflamed airways. This simple step can provide noticeable relief for many people dealing with bronchitis symptoms. Rest is another powerful tool. When the body is fighting inflammation and infection, it needs energy to repair damaged tissues. Getting enough sleep allows the immune system to function more effectively and speeds up recovery. Dr. Rice also reminds patients that antibiotics are not always necessary. Since most bronchitis cases are caused by viruses, antibiotics will not help unless a bacterial infection is confirmed by a healthcare professional. However, there are times when medical attention is necessary. If someone experiences severe shortness of breath, a high fever, chest pain, or a cough that produces blood, it is important to seek medical care immediately. These symptoms may indicate complications or a more serious lung condition. Preventing bronchitis is often easier than treating it. One of the most effective steps is avoiding cigarette smoke and polluted environments whenever possible. Even secondhand smoke can irritate the bronchial tubes and increase the risk of inflammation. Good hygiene also plays a critical role. Washing hands regularly helps prevent viruses from spreading, especially during cold and flu season. Avoiding close contact with sick individuals can also reduce the risk of respiratory infections that lead to bronchitis. Strengthening the immune system can provide additional protection. Eating a balanced diet rich in fruits, vegetables, and whole foods provides essential nutrients that support lung health and immune defense. Regular physical activity can also improve lung capacity and circulation, helping the respiratory system function more efficiently. Even simple activities like walking can support better breathing and overall health. Dr. Rice often reminds patients that paying attention to your breathing is one of the most important ways to protect your lungs. If a cough persists longer than expected or breathing becomes difficult, it is important to listen to your body and seek guidance from a healthcare professional. Bronchitis may start as a simple irritation, but it can quickly turn into a condition that disrupts daily life and breathing comfort. Understanding the symptoms, causes, and prevention strategies can make a powerful difference in protecting your lungs. Your lungs work every second of your life, bringing oxygen into your body and keeping every organ functioning. Taking care of them is one of the most important investments you can make in your long-term health. Now that you know the warning signs of bronchitis and how it affects the airways, you are better prepared to recognize the symptoms early and take action before the condition becomes more serious. Knowledge is one of the most powerful tools for protecting your health and ensuring every breath you take remains strong and clear.